One question that I and many of my colleagues receive when we're seeing families is, if my child's already had an evaluation with the school district, why do I need another evaluation from a medical provider? Its purpose is to provide a medical or developmental diagnosis. This diagnosis is key in unlocking services that would require a referral to obtain in the community, such as pediatric speech, occupational, or physical therapies. Other therapies, such as applied behavioral analysis for diagnoses such as autism, also require a medical diagnosis and referrals. The provider's evaluation will include important aspects of physical and medical health. Evaluations include physical exams, possibly radiology tests, as well as laboratory tests such as genetic testing. Many parents, when presented with the recommendation to see a doctor about a medical diagnosis for their child who is having developmental or serious behavioral problems, are often resistant because of perhaps fear of the unknown, fear of what the doctor may say. There may be a very strong belief and desire to just let things go and expect a sudden burst of catch-up development that will come. I think if I could share anything with families who are in that situation, is to trust the developmental and behavioral pediatrician, to be caring, to be sensitive, to be very interested in you and your child. And that pediatrician really has the best interests of you and your child at hand, and really wants to help you unlock the services that would be helpful to facilitate personal growth and development of your child. I think the timing of the medical evaluation is whenever the concern arises. There is no time that's too early. We really want to identify early and intervene early. There are things that can be done with private therapies and with services such as birth to 3 programs that can help children progress and make progress even before the age of school, which is 3 years old. If there has already been a school evaluation where needs have been identified, then circle back around to the medical provider and ask for the medical evaluation. The evaluation in our office involves a thorough review of the medical history. This means we look back at the medical history of birth, the pregnancy, the birth process, all the medical health that followed after birth, including medical conditions that may affect behavior, development, and learning. We also look closely at the family history. So we'll ask about conditions such as speech delays and ADHD and autism and other conditions that may exist on either side of the family. Sometimes there are clues to what may be going on with the child when we look at the family history. We also look at the educational history, if the child's already been in school, how they've been doing. We will review IEPs and other school testing that's already been done. The behavioral observations of teachers at school can be of great value to the physician who's trying to diagnose. These extra evaluations of child behavior from outside the family are very enriching and help in our accuracy. We also look at the social history so that we understand the environment from which a child is coming from and where they're living, maybe some of the stresses that have been going on within the family unit, such as frequent moves or other disruptions to the child's life. Lastly, we do want to know what's been happening for the child before seeing us. So we'll ask about speech therapy, occupational therapy, physical therapy, and other services that have been happening with the child already. We want to get a sense of who this child is, where they began, and the trajectory of their development over time. All of these things contribute to accuracy in the diagnosis. It depends on the diagnosis. It depends on the level of services and complexity that is present with the child. But often we are following up every 6, 9, 12 months, depending on what's going on with the child, the questions the parents may be having. Are we, as physicians, developmental behavioral pediatricians, engaging in a treatment of our own, such as using medication management to help with specific problems, such as insomnia or aggression or inattentiveness or hyperactivity. In those cases, we will follow up with children much more frequently.